Hello everyone. So today we will be discussing hypertension and how to give nutrition intervention in addressing hypertension in individuals. So hypertension is an elevation in blood pressure where there are more than 2 consecutive readings that are out of normal range. Blood pressure is expressed as a measurement of systolic blood pressure over diastolic pressure. Hypertension affects many Americans, but it is known as a silent killer because there are usually no symptoms. Approximately 1 in 3 Americans in 2016 had hypertension, and only 54 of those were successful in managing it. Hypertension was listed as a primary or contributing cause of 348,000 deaths in 2009, with estimated costs totaling to $46 billion per year. Diagnostic criteria are established by the American Heart Association and American College of Cardiology. Criteria are based on age and presence of comorbidities. For example, reading 130 to 139 or 80 to 89 mmHg are considered to be stage 1 hypertension. It is not necessary for both systolic and diastolic blood pressure to be elevated to diagnose hypertension. An individual who is taking antihypertensive medication is considered to have hypertension even if the blood pressure normalizes as a result of the medication. Prevalence is highest among Black men at 40.3% and Black females at 42.9%. White males have a prevalence of 30.4% and white females have a prevalence of about 27.6%. Asian males have a prevalence at 28.9% and American Indians are 26.4%. Prevalence rates rise dramatically with age. In the age range of the early 20s, it is about 6% for females, while in the age range of the 50s, it increases to above 50% of all females for all races. Hypertension is classified as primary or secondary. Primary or essential hypertension is idiopathic, meaning there is not a known cause. Secondary hypertension results from another primary problem, such as cardiovascular diseases, endocrine disorders, and neurological disorders. The goals of treatment for hypertension include reduction in the risk of cardiovascular disease and renal disease, and also reduction in blood pressure. This consists of less than 120 over 80 mmHg for those 60 years or older. To achieve this, a plan involving weight reduction, physical activity, medical nutrition therapy, and pharmacological intervention is needed. Nutrition therapy is guided by the patient's hypertension history, other medical risk factors, current medical treatment, previous nutrition education, and readiness for behavior change. The first year, it is suggested to have medical nutrition therapy encounters with a registered dietitian nutritionist for at least once a month that first year. 2 to 3 sessions to follow up after that first year should be scheduled to maintain reductions in blood pressure. So, nutrition therapy for hypertension includes lifestyle modifications such as increased physical activity, smoking cessation, weight loss, and reduction of sodium and alcohol intake. Dietary approaches to stop hypertension, known as the acronym DASH, is one of a few clinical trials that has revealed that nutrition interventions of decreasing dietary sodium, alcohol, and saturated fat, while increasing calcium, potassium, and fiber, can lower blood pressure. It was originally one of the 3 studies done in the late 1990s to examine the effect of diet on blood pressure in individuals with hypertension. The DASH diet consists of 2,000 calories a day with approximately 4,700 milligrams of potassium, 500 milligrams of magnesium, 1,000 to 40 grams of calcium, 90 grams of protein, 30 grams of fiber, and 2,400 grams of sodium. Initiating these broad dietary changes and continuing use of them is a realistic approach for treatment of hypertension and prevention of other chronic diseases. It is helpful that it is a broad diet to help allow other cultures and ethnicities to consume their culture-appropriate diets while still maintaining their diet within the DASH guidelines, as mentioned before. The DASH eating plan requires no specific goals and instead provides weekly and daily nutritional goals. This recommends eating vegetables, fruits, and whole grains. It recommends eating fat-free or low-fat dairy products, fish, poultry, beans, nuts, and also vegetable oils. It suggests limiting foods that are high in saturated fat, such as fatty meats, full-fat dairy products, tropical oils such as coconut, palm kernel, and palm oils. And lastly, limiting sugar-sweetened beverages and sweets. Specifically to lose weight, DASH suggests increasing fruit and vegetable intake as well as low-fat or fat-free dairy products. It offers calorie-saving tips as well, such as low-fat or fat-free condiments, or such as drinking water or club soda instead of soda or sugar-sweetened drinks. To effectively limit sodium, the intake of processed foods should be avoided, as well as avoiding foods that are cured, using salt, and also omitting salt during cooking and preparation of foods. Intake should be limited to 2,300 milligrams a day of sodium. DASH offers helpful guidelines laying out how much sodium is typically found in different foods to help others understand how much sodium they are consuming. Many people often intake much higher amounts of sodium than they are aware. Concerning alcohol, the risk for hypertension increases as intake increases above 2 drinks per day for men and 1 drink per day for women. The U.S. dietary guidelines suggest that limiting alcohol intake to 2 or less drinks for men and 1 or less drinks for women per day. 1 drink is defined as 12 ounces of beer or 1.5 ounces of 80 proof distilled spirits. The A&D Evidence Analysis of Hypertension Guideline states that abstinence from alcohol should be recommended with patients with hypertension to aid in blood pressure management. Research has indicated a decrease of systolic blood pressure up to 28 mmHg and a decrease of diastolic blood pressure of up to 18 mmHg in chronic heavy drinkers with hypertension. The DASH diet provides an average of 4 to 6 grams of potassium per day from fruits and vegetables. Leafy greens, beans, nuts, dairy foods, and starchy vegetables like winter squash are also rich sources of potassium. Some more examples include dried fruits such as raisins or apricots, beans and lentils, potatoes, winter squash, as mentioned, such as acorn or butternut, spinach and broccoli, beet greens, avocado, and bananas. People are encouraged to intake the dietary reference intake amount of potassium to aid in blood pressure control. The adult recommended dietary allowance, or the RDA, is 4,700 milligrams per day. If a patient is not able to intake the dietary reference intake, or DRI, with food solely, and this would not cause any risks for their condition, then the registered dietitian nutritionist can suggest a supplement of 37 milligrams of potassium per day to aid in their blood pressure control. The DASH diet includes 900 to 1200 milligrams of calcium. Research suggests that consuming 800 milligrams or more can reduce blood pressure. It is important to try to meet the DRI for calcium. The adult recommended dietary allowance, or RDA, is 1,000 to 12,000 milligrams per day. A registered dietitian nutritionist may suggest supplementation of calcium with 1,000 to 1,500 milligrams per day to aid in blood pressure control. Thirdly, the DASH trial provides approximately 350 milligrams of magnesium. It is important to meet the DRI for good health, but it may or may not aid in blood pressure control. The adult recommended dietary allowance is 310 to 420 milligrams per day. Research is unclear of the correlation between magnesium and blood pressure control, but supplementation of up to 350 milligrams per day to possibly aid in blood pressure control can still be considered, because regardless, it is still going to help the body and its everyday functions. And 30 minutes of physical activity per day can decrease blood pressure by 4 to 9 mmHg. Increasing physical activity also decreases the workload of the heart, benefiting all cardiovascular diseases. Improving cardiorespiratory fitness results in lower percentage of functional capacity used for activities, including the blood pressure decreasing. Physical activity will also aid in weight management. Regular aerobic exercise is recommended to aid in lowering blood pressure. The physical activity should be of moderate to vigorous intensity 3 to 4 times a week for an average of 40 minutes per session. Typical effective interventions of lowering blood pressure include 12 weeks of duration with 3 to 4 times a week on average. Lastly, smoking cessation may be the most appropriate change in an individual can make to reduce the risk of hypertension and all forms of cardiovascular disease. Smoking cessation programs are not all equal, and each individual should seek out a program that fits their specific individual needs. 2 online programs for smoking cessation are the American Lung Association's Freedom from Smoking and also the program Stay Away from Tobacco from the American Cancer Society. I hope this has helped give a clearer idea of the nutritional interventions that support patients with hypertension. Thank you for watching.